Our topic for this video is MIPS, and we will be providing you with an overview of the merit-based incentive payment system to include the changes made under the final rule for 2017 issued on October the 14th, 2016. To review, the macro law specified there to be four components in MIPS. They are quality, replacing the Physician Quality Reporting System, or PQRS, resource use, encompassing what was formerly measured in the value-based modifier, or VBM, the Advancing Care Information component, which was previously known as the Electronic Health Record Incentive Program, or Meaningful Use, and finally a new requirement known as the Clinical Practice Improvement Activities, or CPIA. While the final rule maintains the four components outlined above, some changes were made. One of the most significant changes involves the assessment made in 2017 relative to the component previously known as resource use and now known as cost. This will be discussed with a later slide. CMS has also renamed what we previously referred to as the composite score to the final score. As mentioned above, the quality component replaces PQRS. The final rule stipulates that individual surgeons are only required to report on a total of 6 measures. This is less than had been previously required under PQRS. One of the measures reported must either be an outcome measure or other high priority measure. As an alternative, surgeons can choose to report on measures contained in a specialty-specific measure set, such as the general surgery measure set or the vascular surgery measure set. Group reporting via the CMS web interface also remains an option. The Advancing Care Information component, or ACI, modifies the Electronic Health Record Meaningful Use program. The score for this component is calculated in 2 parts. The base score, based upon 5 measures, comprises 50% of the score and remains an all-or-nothing threshold. The remaining 50%, termed the performance score, is only applicable if the all-or-nothing threshold of the base score is achieved. The performance score is based upon the reported level of accomplishment with 6 optional and 4 bonus measures. In the final rule, what was previously known as the Clinical Practice Improvement Activities component has been shortened to simply improvement activities. This is a new requirement. In the final rule, a total of 93 potential activities were listed. Each activity is assigned a point value of either 10 or 20 points. In order for most surgeons to receive full credit, they will need to accrue a total of 40 points. This translates into a minimum of 2 and a maximum of 4 activities. Those in some rural and small practices will only be required to accrue 20 points. Reporting on the improvement activities in the first year of the program will be by simple attestation, either via a registry or a designated portal on the CMS website. As mentioned previously, CMS renamed the resource use component as the cost component in the final rule. This cost component replaces the value-based modifier, or VBM. It will be calculated based upon available resource use measures from claims data. No reporting requirement was ever proposed for this component. While CMS will calculate an assessment for the cost component in 2017, there will be no weight given to that assessment when an individual provider's final score is determined. This is a significant change from what was outlined in the proposed rule, and the original 10% value assigned to this component has been reassigned to the quality component. Accordingly, the final score for 2017 will be based on 60% from the quality component, 25% from the Advancing Care Information, or ACI component, 15% from the Improvement Activities component, and 0% from the cost component. We continue to believe it is particularly important for surgeons to familiarize themselves with MIPS based on this schematic from CMS, which estimates that for the first several years of the program, most providers, including most surgeons, will participate in the new Quality Payment Program via the MIPS pathway and not the Advanced APM or Alternative Payment Model pathway. To review, MIPS, or the Merit-Based Incentive Payment System, consists of 4 components: quality, cost, advancing care information, and improvement activities. In the videos that follow, we will be discussing both the first year of the program, dubbed a transition year by CMS, as well as the individual components of quality, advancing care information, and the improvement activities in more detail.